Hi, my name is Anthony Wang. I'm an associate professor of neurosurgery here at UCLA. I'm the director of the Moyamoya Clinic and a member of the Comprehensive Stroke Center here at UCLA. An arterial bypass is performed in order to reroute blood flow from one source to another. When we do it in the brain, it's because there's a blockage of blood flow coming from the heart to the brain. That can cause a stroke, and in certain situations, we can circumvent that stroke by performing an extracranial to intracranial bypass. There are a small number of conditions that can necessitate a bypass, and it's critical to figure out which one we're dealing with in every individual patient, because in certain cases a bypass is really the best option to try first, and then in other situations a bypass is the backup option to, for example, medications. The conditions that we most commonly see where a patient might need a bypass include Moyamoya disease or a similar Moyamoya syndrome, and intracranial atherosclerosis, where hardening of the arteries that supply the brain causes blockages that can lead to a stroke. When we do bypass operations, we have to choose a donor artery that doesn't already supply the brain, and occasionally does already supply the brain. And then we have to connect that donor artery to a recipient artery where it would ordinarily be supplying the brain, but for whatever reason, the flow into that artery has been blocked. Once we choose an appropriate donor and recipient, then we open up a small hole in the recipient and we sew the donor into the recipient so that blood that was previously going to other places that are less critical now flow into the brain. The typical bypass operation is comprised of a lot of very small and very critical steps. Our first step is isolating the donor artery without damaging it, and then we have to expose the portions of the brain where we want to target that donor flow so that it most helps the areas that are blocked. Finally, we find the recipient vessel. We do a lot of measuring and testing in order to figure out the best recipient, and then we set up in order to perform the actual bypass anastomosis, where we suture the donor into the recipient. That process takes actually a very short amount of time to actually do the sewing, but then afterwards we do some more testing to make sure that the flow is good, that the flow is distributing in the way that we want it to, and then we very carefully have to close everything back up. Here we're using a fluorescent dye to test that the bypass is open and flowing to supply blood to parts of the brain that were lacking in blood before. I think that the high quality of care that UCLA brings to these patients relies on experience and expertise. We employ advanced imaging techniques that we've developed here at UCLA specifically to look at conditions like Moyamoya disease and intracranial atherosclerosis. The extremely low complication rate, even relative to other high volume centers that we are able to offer our patients, has everything to do with the team of doctors and nurses and their familiarity and expertise with these conditions. If you'd like to learn more about cerebrovascular care at UCLA or schedule an appointment, visit our website at the link below.